Okay, it's 11:30. We'll go ahead and get started. With us today, I'd like to introduce Sylvie Sullivan. She'll be our sign language interpreter today, and we'll try not to move her out of the camera shot here. So we have a few guests with us today. President Tony Guillory's here. Mr. Mike Smith, police juror, is with us also. Any other elected officials we have, if you would, just raise your hand. Oh, Wendy Curfew, or Wendy Aguilar, sorry. We're going to follow the same pattern that we have in other briefings. I'll call on Dr. Kavanaugh here briefly, but just a couple of housekeeping notes. If we have a fire alarm, everybody just exit out the safe doors over there. Ladies' room is in the next hall right here. The men's room is the next one. Also, this will be our last briefing that we have audience here unless you're invited. If you looked at the new CDC regulations now today, they're suggesting no more than 50 people in one spot. That's not the state's advice right now, but just from a practical sense, we've got a lot of people here in a tight space, and we can't maintain that 6-foot social distancing. So we're going to ask that you follow us on Facebook Live from here on out, or whatever else that we advise you. If you have questions before the briefing or after, you can email us or call us. We'll get you an answer for those. But again, in the interest of everyone's personal safety, we will be having invited guests only from here on out. With that, I'd like to invite Dr. Lacey Kavanaugh up for the latest on the COVID-19.
Hey, good morning, everyone. Lacey Kavanaugh, I'm the Regional Medical Director for the Office of Public Health. I'm a family physician, and here to talk a little bit about how the situation for COVID-19 has changed over the past couple of days and through the weekend. Behind me, you can actually see our current statistics for Louisiana. This is a new website that launched over the weekend that has all of the current numbers of cases within our state, the parish that case is in addition to how many people have died from COVID-19. And right now, as you can see, 114 confirmed cases and 2 deaths. And the state lab has run 302 tests. The number of tests run does not include any labs that were done in the private sector through either Quest or through LabCorp. So as those testing capabilities come online, we will still get notifications of positives from those third-party lab companies, but we don't always get notification of every negative test that is run. So this is the number of negatives that have been run at the state lab, not necessarily encompassing all negative tests that have been run. One of the new things that also happened over the weekend is that it is no longer required that the state lab sends samples that turn positive to the CDC for confirmation. So the test has been proven to be good enough that a positive is a positive. And that also goes for that private sector lab testing capability through our private partners. So you will no longer hear the language of a presumptive positive, a preliminary positive, and then a confirmed positive. From this point forward, a positive is a positive. And if it is showing up on the new state website, then that is a confirmed positive. Wanted to talk a little bit about social distancing because we keep hearing that term and we kind of understand that means that we ought to stay away from big groups of people, and we understand that we should all be washing our hands and covering our cough and staying home if we're sick. But a lot of people don't really understand the why. Why do we care so much about social distancing? And the reason is because this virus can spread up to 6 feet around someone who is sick if they are coughing or sneezing. But it's not that lots of people are not going to eventually probably get this virus. When we socially distance, we slow down how fast these viral infections happen. If we all in this room today got the virus at the same time, that would put a pretty big strain on our healthcare system. So that is part of the reason that we are socially distancing, to slow down the speed at which the virus spreads and allows our healthcare systems to keep up with the demand of testing and of treatment of COVID-19. And so that is why it is really important that everybody plays a role in social distancing to the extent that they reasonably can. And as you heard from Dick, the CDC has now, as of yesterday, put out some new guidance recommending that groups larger than 50 not get together. Although that is not necessarily an official state guidance or policy at this time, it is still a pretty strong recommendation from the CDC that we really all ought to be listening. So just because school is out doesn't mean that you need to gather a big group of people at your house for crawfish boil, you know? So we need to really think about that, not just in terms of our own personal risk, but of the risk that we could have a very, very mild case individually and not even really realize that we could have it and then potentially spread it to other people within the community. And so it's for our own protection, but also for the protection of our loved ones and for the protection of our healthcare workers and our hospital systems. So it is really important to socially distance, and that's what it means. Also like to talk a little bit about the fact that even though we were in the middle of this virus and response to this virus, all of the normal healthcare concerns that people have about if they have, say, hypertension or diabetes or they're undergoing treatment for cancer, those things don't necessarily stop. Accidents and MVCs on the side of the road, they don't stop just because we are responding to this virus. And so we really need to make sure that we are not going into healthcare facilities for no reason. There's no reason to test people for COVID-19 if they have no symptoms. And we've gotten lots of questions and requests from folks who say, I don't have any symptoms, but I might have been exposed on a cruise ship 2 weeks ago, so I want to go get tested so that I can go back to work. But they have no symptoms, and there's no recommendation to test people without symptoms. So we all need to be cognizant that our emergency rooms and our doctors and our hospitals are going to be pretty busy dealing with COVID-19, so we don't need to, as a society, be flooding their office with concerns about just being tested just because. We ought to be, if we have symptoms, calling them and talking to our doctors' offices and our hospital systems about if it's appropriate for testing. I know there has been a lot of frustration about the availability of testing, right? You've heard people who say, I have symptoms and I want to be tested, but there's not a specific place to go to get tested. You may have heard that some of our local hospitals are trying to get together and create that availability so that there will be a place for our physicians to refer potentially positive cases to get tested. And that testing capability is ramping up, and it's getting better every day as more supplies are created, as more of the viral transport media gets down to the level of the state and gets out within the community. But right now, there is still some challenges in terms of getting everybody who qualifies or who has symptoms, physically getting them a test. And so we understand that that is a challenge, and I can promise you and assure you that we are working very hard to make sure that we get testing rolled out. And the last point I'd like to make is that if you have a very mild case of COVID, which most of them are mild cases that have mild symptoms, that the treatment is probably going to be to go home and self-isolate, unless you are sick enough to require hospital stay. Of course, there are severe cases, and you've heard about those that do require people to be in the hospital. But many of the cases of COVID can be treated at home and should be treated at home because there is no antiviral, there is no vaccine. It is supportive treatment. And so while some people do end up in the hospital, I do not want folks to be surprised if they test positive and their healthcare provider then says, okay, you need to go home and isolate yourself to make sure that you don't infect anyone else. So whether you end up at the end of the day testing positive or whether you you end up not able to get a test for whatever reason, the treatment for that is still going to be the same, which is going to be to go home and isolate yourself so that you don't infect other people. So with that, I will go ahead and leave it. Those are most of the points that I wanted to cover today. Thank you all.
You have a microphone in front of you. They're push to talk. There's a little button on them to activate them if you have a question. I'm going to let Dr. Kavanaugh answer some questions, and then we have a few other comments.
So if you think that perhaps you're severe enough that you need to be hospitalized, what should you do? Yeah, obviously, you don't want them to just show up at the hospital. Should they call their doctor for advice or what?
So if it's an emergency, they would follow the same procedure as if it was any other emergency. If there is the ability, if you're sick enough to say feel like you need to go to the emergency room, it would always be appreciated by those hospital systems if you called first before coming, because that gives their staff time to prepare and make sure that they have the proper personal protective equipment and that sort of thing. But in all cases, that may not be possible. If it is not possible, then, you would still follow your normal mechanisms and go to the ER if you have a potentially critical illness. And call your regular doctor's office if it is not that severe.
So going forward with the state and government buildings and meetings like this, will they be taking your fever, testing your fever, or any other type of tests in order to, so that no one in this room, the interpreter, yourself, or anyone else, will not be spreading it to anyone else?
So there has been some movement at the state level that some of the state buildings are starting to do that. I think that in general, that would be a good practice, but it will not always be feasible in every situation. So that will eventually be up to whoever is in charge of that building to kind of put those processes in place. But yeah, temperature checks at any absolutely mandatory big group meetings are a practice that I think would be considered low risk and potentially high benefit.
What can you tell us about whether there have in fact been people in Southwest Louisiana who have been tested and tested negative? Because we're still of the belief that there are no cases here, right?
Right, so I can tell you that there have been people tested. Unfortunately, I do not have an exact number of people who are tested because, as I have explained, not all of the samples go through the state lab. So we have visibility on those samples that went through the state lab from the region and were tested negative, but not necessarily if they went to the private LabCorp or Quest. We wouldn't have a way to really know how many of those samples came back negative because they're only required by law to report positives.
What, if anything, would you say about perhaps what would you suggest people do about the high anxiety? Obviously, there are a lot of people in the community suffering high anxiety with everything we're hearing from around the country as well as around the world.
So, that is a challenge, and you're right that there are many people who have a lot of anxiety right now. I think that one of the things that people need to do is kind of make sure that they have their own personal preparedness plans, like we encourage them to do all the time. Even for other events like hurricanes, we always talk about how to be prepared as a family and how to have a plan for as a family. So I think that if people have those personal plans, that gives them a little bit of reassurance that they're ready for whatever may come. I will say that staying off of social media and not following rumors definitely will help. Make sure that you get your information from official sources, from the LDH website, from the CDC website, because there are a lot of rumors and theories that really don't have a whole lot of validity that go around, and I think that those increase anxiety as well. Also, if people have pre-existing mental health conditions, of course, situations like this that you're hearing a lot from media about stressful situations and that the toilet paper on the shelves are out, you hear that. That can be a trigger for people who have mental illness. So making sure that if you do have mental illness and you have a doctor for that you are talking with them about your concerns and using techniques to settle those symptoms down.
I think some people are worried that they may not be able to get their regular medicine in the future, since we've heard of some businesses closing or shortening their hours. What, if anything, would you suggest those people do? Because obviously some prescriptions you're not allowed to, get a 3-month supply ahead of time.
So I would suggest that individuals talk to their doctors about what their plans should be, because every medicine is different. Some are obviously critical that you can't just stop. Some are not as critical. So I think that it's hard to make a general recommendation about that. So I think that people who are on chronic medicines need to talk to their doctor about what their plan is.
What, if anything, can you tell us about the casinos? Because some people are concerned with this recommendation that the CDC made about no more than 50 people, yet obviously many more than 50 people wander around the casinos, and perhaps the casinos have updated their policy and I'm not aware of it.
So I'm going to defer that question because I do not have any specific information at this moment about what they are doing, and maybe Dick, you might have more information about that.
Okay, thank you.
Yes, can you maybe tell the difference between what a mild case and a severe case as far as symptoms, and as far as these rumors that you're talking about, what's being spread that's just totally bogus that you can expound upon?
Lots of things, and I'm not going to get into all of them for the fear of spreading them further. In terms of symptomatology, mild symptoms are usually going to be low-grade fever and a dry cough, some upper respiratory symptoms, but not as many as lower respiratory, which would be like coughing. Severe symptoms, you're going to start to get short of breath and higher fever, and to the point that you feel like you can't breathe. And there are cases that end up requiring ICU care for either oxygen or to be on a ventilator. Can cause pneumonia in severe cases.
So just one more question. Right now on the board, it's not showing anything in Lake Charles, and that's good for right now, and Lafayette and Baton Rouge. It could happen like that. We've seen the numbers blow up very quickly. So let's say if Lake Charles reports 3, Lafayette 2, and Baton Rouge 4, can you speak on, okay, what's next? What we're going to do then? Because we know C is spreading, so we know it's going to happen.
Right. So I do think that whether we have no cases or 1 case or 10 cases here, our actions now should be to prepare for if and when we get cases. I mean, that is what we are already actively doing and what we have been doing for quite a while. I will let Dick comment if he has any other specific actions that you know of that the parish would choose to take. But I think that in general, the recommendations of hand washing and social distancing, when we're talking about potential policies to monitor temperature, all of those things are going to be what we are going to continue to push even after we get our first case. So it's not going to be a magical trigger, that changes what we do. We need to be preparing as if we have cases now. All right, thank y'all.
Thank you, Dr. Kavanaugh. I'm going to call on Sergeant James Anderson right now, Louisiana State Police, to address the casino question.
Good morning. News outlets across the state have started to report that casinos in Louisiana will close effective midnight. I have just confirmed this. This is indeed the case. I want to make clear this applies to non-Indian casinos. Those Indian reservations or sovereign nations Those officials will make those decisions at their facilities. But as of now, Louisiana casinos will be closing as of midnight. At this point, this does not apply to truck stops. This does not apply to video poker outlets at this point. That is, of course, subject to change. This order will be in effect for 14 days and will be reevaluated at the end of that 14 days.
Thanks, Sergeant Anderson. Our operational status hasn't changed. We're still proceeding with our planning. I do have the Director of Allen Parish, John Richer, here today. John, did you have any news from Allen Parish that you needed to get out?
No, we're monitoring what's going on, and we're following the guidance of the health department.
Okay, thank you, John.
There is a shortage of food and supplies coming through with the run on the stores.
Right. I was going to address that.
Thank you.
That's all, John? Okay. I have a couple of points I want to make. We're getting a lot of calls about if I leave the parish, will I be able to get back in the parish? Well, there's no curfew orders, there are no ingress, egress orders right now in Calcasieu Parish, nor in all of Region 5 that I know of. And these are just some of the type of questions we've been getting today. The hoarding situation, the president addressed that last night. We're not having a hurricane. Our infrastructure is not likely to be compromised by anything that's happening with this disease right now. So, just person to person, get what you need, but leave some for everyone else. Have a couple of questions here that Teresa gave me and these are just general concerns that have been expressed to, those were from us, and then I have a couple here that came to KPLC. She's already addressed one about the confirmed cases. There are no cases in Southwest Louisiana. Has anyone been tested? And I think Dr. Kavanaugh already covered that question. The question about prescription drugs, and just to reiterate, the best source of information on that is going to be your personal physician. The pharmacy can't change your prescription orders. That can only come from a physician. And I'm not sure if we covered this one. Should sick people who test negative after the flu automatically get tested for COVID-19? If you were sick and displayed symptoms and tested negative for the flu, would you be in line for a COVID-19 test?
So it depends on the symptoms, but if it is fever and coughing or other respiratory symptoms, and you test negative for the flu, then yes, that would be a case that will qualify for testing for COVID-19, but not necessarily other non-respiratory symptoms. So if someone has the stomach bug, that would not necessarily qualify for COVID testing.
Thank you.
And again, Dr. Kavanaugh covered this, but just to reiterate, because we get a lot of questions about this, if you think you display the symptoms, call your personal physician or go to a walk-in clinic or something like that. You will not be tested unless you have orders from a physician. So we just need to be clear about that. Apparently some people think that there's a way to get tested without having to go through a doctor, and we don't know of any right now. Dr. Kavanaugh, is that correct?
That is correct.
Okay. So I'd like to open it up for questions now. Does anyone have any questions? If you could, either use the mic on your table or one of the staff here will bring you a microphone. No questions? Any other comments? Anyone have any comments?
Well, what about, I'm sorry, I can't figure out how to Work this thing. Okay, sorry. How satisfied are you with the, behavior that you're seeing in Calcasieu Parish or in Southwest Louisiana? Obviously, it was probably alarming to many people to see everyone partying in the streets of New Orleans. How pleased are you with the way people here are conducting themselves?
I would say, just from my personal experience, we've been out over the weekend, various, places. I think people are very concerned about this, but I don't get that they're really what I'd call panicked, other than the grocery situation. So I think people are listening. A lot of people already know all of this information that we're covering. I think they just want to hear it from an official source to make sure that that is correct information. The biggest question we get, again, every day is, has someone in Calcasieu Parish been tested positive for COVID-19? And really, this is this is the source that we use right here. So if you see that, you have the same information that we do. And my recommendation, if someone asks you about it, refer them to the LDH page. Just a comment, we're also monitoring the Texas has a similar page to this. We're monitoring that because, as someone pointed out to me last week, Texas is only 30 miles away, and it's just it's a line on a piece of paper. It's not anything there to prevent cases from coming over from Texas. So, Denise, did you have something? The microphone?
I just wanted to remind everybody in the general public that 211 is still a valuable resource for all of us. And as of yesterday morning, we've actually answered over 2,700 phone calls through the state of Louisiana. And more incredibly than that, on our texting platform, over 8,500 text messages that with direct links to the CDC and Louisiana Department of Health. So we're there for the community 24/7. So just please remind anyone you know to call 211 if they want non-emergency information about the virus.
Okay. Thank you. Now it's Denise Durrell, United Way of Southwest Louisiana. Richard, I know you weren't prepared for this, but can I ask you if you've been getting any unusual calls at 911?
To date, whoa, that's loud. So far to date, we've been getting normal calls.
Okay. No unusual calls about COVID or anything like that?
No unusual calls, and the call volume is right where it normally is.
Okay. So again, like we said in our last briefing, life goes on, and I think Dr. Kavanaugh covered this also. To the extent that you can, follow your normal activities. We're going to obviously discuss not having larger group gatherings like this, but as long as you keep your distance and use those health precautions that we have talked about over and over, you should be personally protected for as well as we can. Anyone have anything else?
Mine would be on the Indian casinos. If the casinos are starting to close down in Calcasieu Parish, they're going to move on to Allen. If the trooper is around, I believe.
Yeah, James.
What
could
is
you
it?
address that?
Who's making contact with the Indian Affairs?
So that is a decision that has to be made by that reservation officials, those reservation officials. So they're going to be made aware of this. The Game and Control Board has already given a heads up to the casinos across the state as to what's taking place. They're getting the same news alerts that are going off on all our phones, so they know what's coming.
Okay. Anyone else?
That raised one more question in my mind. I just wondered, I realize that they're a sovereign nation, but is anyone with the state or any other entity communicating with them and urging them to take?
Well, I think Trooper Anderson had the correct answer. It's going to be, the state police does, even though it is a reservation, state police does have some regulatory control over them, but the state has an Office of Indian Affairs and other things, so I can't answer for that, but I would think they are.
Okay.
Yeah.
All right. Perhaps I wasn't clear. Okay, we have state police stationed at all casinos in the state, including ones in Indian reservations. So we have state police officials at each casino, including the Indian casinos. So they are going to be aware of what's taking place. As soon as I finish this, I will get off the phone. I will ensure that our sergeant at Coshada is aware of what's taking place.
Okay, thank you.
You're welcome.
Okay, and we had Mr. Lewis, a police juror, join us during the presentation. Okay, anyone else have any questions? Like I said, from today on, it'll be invitation only for the audience here. However, if any of you have any questions, make sure you call us or email us with those questions. We'll get those addressed, because these questions from the public are very helpful. We want to address what is on people's mind. It doesn't do us any good to get up here and talk about what we want to talk about. We want to hear what you want to know about. So we encourage you to get those questions in, and we'll address them each day at these briefings. Okay, thank you.